Okay, so we're going to recap a little bit about bullying and also neglect. Two very important areas that we need to cover again, because the more you hear and the more that you are exposed to it, the more it's going to start to sink in, right? So, why does bullying happen? Well, we have the unresolved trauma, we have all the, we have hereditary, and we have like the loss of control and power in somebody's care. That could be a huge factor of somebody having their anxiety being heightened, to them not understanding what is happening with them because they're so focused, hyper focused on something that has not been addressed, that they have no idea what their test results are or any of that kind of thing. It's very important that the patient and yourself also has feelings of control with the situation, and also power, because when somebody doesn't have it, that loss of power, the powerlessness, and the lack of control, it really weighs down on somebody. Okay, so we were talking about bullying, and now we're going to talk about neglect. Basic human needs, extremely important. So nurses barely even get a break. And if they get a break, then will their patients be taken care of the way that they took care of them? That is often a struggle that nurses go through when they are trying to make sure that everything is done correctly, because when it comes down to it, it is their responsibility for that patient's safety, their care. And if something happens and that patient doesn't get something that, maybe they asked for, or maybe something happened and they don't have anybody that's going to immediately come in, well, that's kind of hard to do, but somebody that's going to come in to assist them, how is that? Are they going to get angry, or are they going to get bothered? Is that going to trigger something? Right? More than likely, because they're the ones that are not feeling good. And then if you're not feeling good, that also is a huge problem. And there's a price that's going to be paid. It's either going to be through physical or verbal escalation. And that's something that we're trying to prevent. Um, we also need to acknowledge that people with, especially with COVID and even with us taking care of patients on the front line, that loss of we have the loss of power, the loss of being heard, but we also have isolation now happening in massive amounts with our patients. So they're put into a room and we can't even have communication with them unless it's by phone. And we can go into the room, but we have to eliminate the long periods of time in that room. So we have to go in, drop it off, and drop something off and leave. I mean, that's just the way it is on the floor. So there is a lot of people that are feeling ignored, especially with healthcare. We talk about PPE, we talk about all that stuff and our safety needs. And if we feel like it's being ignored, and then there's intimidation in the process. So a lot of it has to do with neglect. And if we are not taking care of ourselves, how are we taking care of our patients the way that we would like to? We aren't, because there's several different factors of what is happening in our practice that's holding us back from being able to sit at the bedside and hold a hand. And we're going to talk a little bit more about that as we get into chapter 2. All right, so here we go. Chapter 2, filling the gaps of in education. So just as basically what it says, I can't even, there's so what we're trying to show you is that, and you do need to know that, the Board of Nursing makes the curriculum frameworks, and then they hand that off to the Department of Education, and that is when it is disseminated among the schools of nursing. And sometimes the nurses have to go and find it themselves, and from there they pull resources like the latest textbooks that they have to use. That's with the school. Anything new that might be coming down the pipe. That's if you have somebody that's innovative. And then we have instructors without a mental health or addiction specialty. They're building unfamiliar curriculum. That's just like saying somebody with a mental health background going to teach maternity. like I've had a baby, right? So okay, so we are it's very important that we understand where the frameworks come in. So the nursing curriculum frameworks are built by the Board of Nursing. Now, those that are building the curriculum have not been on the floor. If they are on the floor, it's awesome. But they have not been on the floor for about 5 to sometimes even 30, 40 years, right? So they're building this curriculum. It's all the basics, right? Yeah, that's wonderful. But we have societal trends that need to be adhered to. So if we've had an opioid epidemic for about 15 to 20 years, what ends up happening when when this person is being if it's not in the frameworks and this person in front of us is clearly having a large amounts of sweating, they're getting anxious, they're angry, they have goose pimples. I mean, how are you supposed to be, how is a nurse, we don't even teach how to look at that stuff. We teach them the basics in nursing school, but how are they supposed to take care of anything that's such a high incidence of? Why are we not teaching this as nurses? It is not about, nursing school's hard enough to teach and we have a lot on our plate, but how are we missing this mark to keep our nursing students that are graduating with us safe? Very important stuff here. So and instructors without mental health or addiction specialties are building unfamiliar curriculum. This is just like saying that somebody with the mental health background is teaching how to give birth to a baby. So why would we do that? Well, here's one argument. So if you have a nurse that specializes in mental health, can they still take care of somebody that is having a baby? Yes. But what is their scope of practice? Well, yes, basic nursing, basic nursing, right? Sometimes if they've worked in med surge, they know med surge. Do they know how to, help somebody give birth to a baby? They do, but they don't, right? Is that in their scope of practice? No, it's not, because they've done med surge, they've done mental health. But here's the thing, is mental health its own specialty? Yes and no, but it's a specialty that everybody has. Everybody has some form of mental wellness or mental imbalance that needs to be addressed. So if it's not addressed, how do you think their pain is going to be when they're using drugs and alcohol? Their mental pain, right? That's what they're trying to help with their using opioids or getting their next high, right? A lot of it has to do with mental pain, things that they've gone through, unresolved childhood trauma, unresolved life events that have been traumatic to them. Okay. So now we have nursing students that are now graduating nursing school with scenario based programs with COVID. Are these nurses understanding the things that they need to be successful in this program or even into the healthcare profession? Absolutely not. They know very, very basics, and that is it. We can go into this over and over again. So we have this big fat hole in nursing curriculum. And it's unfortunate for the students because we had a hole when I was in school back in 2000. Oh gosh, way back when, 2000. Oh, Lord, 2008, somewhere around there. And, and then my LPN and then my RN program never was really taught about, autism, traumatic brain injury, acute mental illness, addiction. I was never taught any of that stuff. I learned it out on in the floor where you had to dodge a chair being slung at your head, or you had to work with them with this and this and a little bit of love, because otherwise you were going to get hurt. And I was always in those units that were, at any given moment, there was something that was going to pop off at any given moment. So we have taken, not only for the past 30 years that I've been in nursing, from working as a nurse's aide on up to being an RN since 2010, All these things in not only education, we have built this program to help fill in these little holes and gaps everywhere that is not being used in other areas, right? There might be a slight similarity here and there, but there's nothing out there like this. The Holistic Behavior Prevention Program is what we are presenting today. It is prevention of violence. It starts from within and taught in nursing school, encompassing the tenets of holism in nursing, because we're taking care of the whole patient, not just med surge, not just mother and baby, not just this, not just that, right? We are teaching to take care of the entire person. So you have medical and you have mental health, and now they're getting married, right? Now it's going to be a happy marriage. we have to have awareness of the problem in order to be able to make it right. Correct? Absolutely. So recognizing and communicating with your peers and your patients, we have to be able to talk to our peers like, hey, I see you, what's happening with you, let me help you, right? Everybody needs a little help once in a while. Conflict resolution, the team approach. We're going to discuss that a little bit later. It is something that is designed for Nurses Against Violence Unite, and I am actually incorporating it into this program. So we're back to accommodations. Accommodations for learning and work training. So where are they? Right? We have, obviously, there's been something nurses might be ashamed to say, I don't process the same way that everybody else does. So, and then you hear a lot of nurses say, oh, I have ADD. Every nurse has ADD, right? Yeah, probably. But here's the thing, you're federally protected if you have literally this problem, which is not a problem, it can be a superpower, as long as you channel it correctly through, good coping mechanisms, through, doing some personal development, keeping yourself and your mind okay, right? Same thing goes with, your traumatic brain injury. You have to train yourself to do a lot of the things that you could do before your injury, and to perfect it in order to be even better than, moving forward. So accommodations are federally protected. They are a part of the American Disability Act. Accommodations are not always followed for students. So when you have a student that's having any issues in their program, or even learning things on the floor, we need to be, understanding to a degree, right? We don't fully understand what's wrong with somebody, but if somebody says, I process things differently than other people, then that needs to be, taken into consideration. Yes, they should tell their employer, but more times than not, it's considered as a disability. As we were talking about earlier in the program, we are labeling people every day. We are judging people every day. You have your trans people, you have your people that, have ADD, you have the traumatic brain injury, you have the addict, you have this, you have the schizophrenic. It's like, when we take out this whole labeling thing, what we have is we have people that need love. And we need to understand that not everybody is the same, because I'm not the same as everybody else, right? So programs lack specialized education such as mental illness, autism, all the way up to Asperger's and beyond, right? Traumatic brain injury. And then we have ADHD, the inattentive type, which, remember, ADHD gets worse as somebody gets older. We have the childhood kind, which is for hyperactivity, mainly school age, where the lack of recess, we talked about that, and the coping that they're not able to do has been eliminated. And then now with COVID, there's no kids playing anymore. And then you got predators that are out there. I mean, there's just so many factors that just not only scares people to have their kids outside, but in the, at school, they're not able to go to actual school for the most part. Some are, some aren't. And they don't have recess. They do, they don't. Regardless, they're isolated. and they're taken away from their friends. They're not able to laugh spontaneously if they want in class because something might be funny, right? Unless it's at the expense of somebody else and making them feel bad. So, and again, there's non-adherence to all learning modalities. So I'm a hands-on learner. Like I can't learn anything unless I am doing it hands-on. Like it takes a long time for me to be able to process things at sometimes, right? Again, I'm not the same as other people. I could sit here for days on end fine tuning this PowerPoint until I say enough's enough. I need to get up and I need to just move on and fly because it's going to take some fumbling in order to get through, this life, period. And we all need to accept that. And then the cookie cutter design of education. It's when you have a curriculum frameworks, it's not adhering to every learner, right? That is the nurse or the educator that is teaching the programs in order and effort to help every person understand. Remember the no child left behind? Well, what about the no adult left behind? There's a lot of that happening as well. We are not taking care of people and their educational needs. And that is why we have a lot of noncompliance in healthcare and we have such a high deficit because people are not adhering to their treatment modalities. And we also don't have an education system that is using material that's adhering to societal trends in order to make things more understandable. Is that any fault to them? No. Okay. They could do better. That's the innovation part within the program. But when it comes down to it, if you don't know there's a problem, you don't fix it. Right? And that is why we have to advocate and we have to stand up and make sure the curriculum that we are working with, if you're a nursing student watching this, you are valued, right? We love you. I just had to throw that in there. If you're a nursing student watching this and you're trying to find out some more things about, and get the certificate program, I want to thank you first and foremost. This is not just about mental illness, autism, traumatic brain injuries, and ADHD. This is about relationships. This is about holes in the curriculum and about how we can get you to do better, right? As well as also helping the experienced nurse to love them where they are and to help them understand and feel supported, right? Because everybody has something that they need the most of, right? So we have bullying, neglect, and lack of education. These are huge proponents to a failed system. Okay. So if we don't recognize it, it doesn't get fixed. We have to bring awareness, educate, and we need to empower people to eliminate violence in healthcare, right? Because it's not necessarily about the patient beating up the nurse. This is about everything encompassing how we all interrelate, as well as also how and the knowledge that we might and might not have in order to help with our tools for a good, successful um, uh, profession, career. So the bullying, neglect, and lack of education, the results, there's missed opportunities of growth, right? So by being judgmental, by being, labeling people, taking away their power, like not letting them make choices is what I mean by taking away their power. There's missed opportunities for growth. It compounds itself, all these stressors over a period of time destructs the DNA, and it actually for generations after that point has some sort of destruction that has happened, and it affects the children thereafter. So when you have when you drink, you smoke, you even breathe the air, you do drugs, any kind of unhealthy coping mechanisms in regards to anxiety, stress, problems that you're facing, you are going to, it's going to compound itself and your health is going to deteriorate. And then from there, from generations on, right? So what we have here, what contributes to this, we have frustration, anger, lack of fulfillment. I didn't do a good enough job. I don't feel like I did a good enough job. Why couldn't I have done a good enough job? We have burnout, PTSD. That is over a period of time. There's acute stress disorder, which is within 30 days. Then you have post-traumatic stress disorder that happens after 30 days. Bad sleeping patterns, like all of this really plays a toll on your body, and also not just your body, but your mental health and your immunity. Um, Stress and anxiety plays a huge part in that. So I have a scenario that I would like you, I'm going to have you read, and then there's questions that I would like you to answer. Now, you may not get these questions back, your answers back right away, but there's going to be an opportunity for you to answer them. They may be true, false. They might be, they might be essay form, depending on what your program, your program of your workplace or, what have you would like you to have. I personally would like the essay form. So I would like to make sure everybody understands on every different level. All right, so here's your scenario. It had to take me a couple seconds to get back on track here. Your scenario is Dr. Myers, by trade, is a CRNA for over 15 years and decided to start teaching at a local college to fill in her time and share her knowledge with new students. The nursing director lost an instructor and asked if she would mind filling in to assist by building curriculum for the basic med surg class that's coming up. Dr. Myers feels confident that she can accomplish this, but hesitant as the frameworks given to her were bullet points only from the Board of Nursing given to the Department of Education. You notice how I repeated that, right? Reluctant, but willing to try and help, Dr. Myers constructs the curriculum and starts teaching it. And nursing students are failing on multiple exams. The nursing director tells Dr. Myers that students are complaining about her, but no worries. I have your back. These students have historically been troublemakers. Having false sense of appreciation, but willing to keep up to fulfill her commitment, numerous hours of tutoring. Her students are, on off hours of her own time and spending more time on a part-time position than on her CRNA position. So Dr. Myers turns in her 2 weeks notice because she does not feel, fulfilled. She does not feel like she is making a difference because people are complaining about her performance, but yet telling her that, it's not her, it's somebody else. The nursing director told the administrator that Dr. Myers was not helping her students. The students were angry with her, stating that Dr. Myers is unprofessional and was wearing a sweat jacket on a Zoom lesson. The administrator confronted Dr. Myers, stating not to tell the students that you're leaving. We will pay you for your 2 weeks, then told her to leave. So the questions that you're going to have, how would you feel if you were Dr. Myers in this situation? What would you do if the administrator said this to you? And what advice would you give Dr. Myers, right? Would it be sound advice? What kind of advice would you give Dr. Myers? And then how would you support her as a peer, as somebody that is learning from her? If you see that, people are complaining in the class, how are you going to support your instructor? Right? How are you going to instruct your peer? And how are you going to support your subordinate? Like, how are you going to support your staff? So there's different things that, if you're in that role of being a supervisor or an admin or something like that, how are you going to help Dr. Myers in this situation? It's very important. So especially seeing all different kinds of situations in this, especially something like this. And then we're going to get into chapter 3, which is anatomy of workplace violence. And this is when we start getting into more nuts and bolts of what is happening out there in order to, of course, make it better. Because without understanding, we don't know, right? And how do we truly understand unless we've been in that situation, which most nursing staff has been in a volatile situation, either physically or verbally, or suffered some form of abuse from, you know, a peer or admin or somebody. But we're going to take this and twist it so you understand it a little bit better and the underlying factors in order to be able to do better and feel better at what you do on the floor. Because more times than not, you can squash a problem before it gets out of control. And I want to make sure that you are virtually hugged because you are valued and you mean a whole lot to not only myself, but everybody in our groups. So hang on, we're going to get into chapter 3.